Welcome back, everybody, to part 2 of our gram-positive coccus talk in our medical microbiology for medical students lecture. So now we're talking about streptococcus, which is a gram-positive coccus that's organized in pairs and chains. The first one we'll talk about is beta hemolytic strep. In a minute, I'll explain what beta hemolytic means, but essentially the thing that you have to remember is that this means that they are nasty. These are not our friends. If you see them, it is a problem. Sometimes people call this groupable strep because a lot of these species are easy to put into groups based off of certain tests that we do in the laboratory. So, for example, group A strep, or GAS, is something that you'll commonly see both in inpatient and outpatient settings. The actual species name is Strep pyogenes, but you'll hear people say group A strep as well, just because it's such a common way of describing it. Similarly, group B strep, the species is Strep agalactiae, but you might just hear people call it group B strep or GBS. There's a few other groups like group C and G you will sometimes see in patients that are less common, but all of these together share features that they are beta hemolytic, they can be put in these groups, and they are nasty. So here's some nasty photos. On the left, we have an example of a patient who had necrotizing fasciitis, or what's commonly called flesh-eating disease. So this is usually caused by group A strep, where it can get in and cause cellulitis at the skin level, but it can also go even further and start to infect and destroy the flesh underlying the skin, like the muscles and the fascia. And these require very extensive surgeries, and you can lose your limb or even die from them. So this is a very nasty infection. Similarly, group B streptococcus can cause life-threatening infections in any patient, but it's particularly common in newborn babies. So if a mom has group B strep in or on her body, and then when the baby is born, that bacteria transmits to it, because of how vulnerable their immune systems are, they actually can have a life-threatening infection and have meningitis or die. So group A and group B strep are very common and very serious. On the right, we have a picture of strep throat. So strep throat is also caused by group A strep. The reason I'm including this here is just to show, even though these infections can be life-threatening and they can cause all sorts of different infections from head to toe, they also cause very common infections that are not generally life-threatening, like strep throat. So if you see group A strep or group B strep or another groupable strep in a culture for your patient, you should definitely treat it as probably real and probably related to whatever symptoms your patient is having. And then those patients would need antibiotics. These are almost never contaminants. So, I do have to explain now what is beta hemolysis. So hemolysis is blood cell destruction caused by virulence factors that we find in these nasty groupable strep, as well as a few other species. It's a very simple phenotypic test. We're commonly using blood agar in the laboratory, so it's as easy as just picking up the plate and looking and seeing what the red cells look underneath. It's not 100% reliable, but again, it's pretty good. So here on the right is a picture that if you Google beta hemolysis, you'll find every single time is the first result. So here we have the letter beta drawn out with the organism, and you can see that all of the red cells on the rest of the agar have actually been totally destroyed, and it's just totally clear underneath. So this is what we mean when we say beta hemolysis, and Strep pyogenes and Strep agalactiae will have an appearance similar to this. On the left, we have an alpha for alpha hemolysis. That's the abbreviation for when you just have a partial hemolysis. There's a bit of red blood cell destruction, so you get this kind of greening, but it's not clear the way beta hemolysis is. This is actually not that helpful, mainly because there's so many different types of strep that can do it. But just to be aware, that is what alpha comes from. I don't know why alpha is first and beta is second. Similarly, I don't know why gamma hemolysis is the description for no hemolysis. You think it'd be easier to just say non-hemolytic. But this is when you have an organism that is not causing any destruction of the red blood cells underneath. And again, there's a lot of strep that are gamma hemolytic. And so this is not really a very helpful description. So essentially for you at the medical student level, you need to know what beta hemolysis is, and the rest of these are not really going to be very helpful. So to go back and have our little summary slide for beta hemolytic strep, we have our picture of beta hemolysis, and that should be your trigger to remember beta hemolytic strep are nasty. They destroy cells, whether it's in the skin and muscle or in a newborn baby, or even a mild sort of throat infection. Next, we'll talk about strep pneumo. This is also called the pneumococcus, but I find that a bit old-fashioned, so I just call it strep pneumo. So strep pneumoniae is also a nasty guy. Strep pneumoniae is not beta hemolytic. It can be alpha hemolytic or not hemolytic. And it can be part of the normal flora. A lot of people, especially children, do have strep pneumo in and on their bodies, common places in the face, like in the sinuses, in the mouth, in the throat. But it also causes very severe infections. So pneumonia is probably the most common one. Again, this is why it's called the pneumococcus, is because it is the organism that probably causes the most bacterial community-acquired pneumonia. It also causes other life-threatening infections like meningitis. Here on the right, we have a picture of a child kind of from a pre-antibiotic era who has bacterial meningitis, and this is commonly caused by strep pneumo. We do have, effective treatments and vaccines for strep pneumo, but it's still very common. So this is definitely an organism that you guys need to be aware of. Next, we'll move on to the viridins group strep. So this is kind of analogous to coagulase negative staph in that viridin strep are a bunch of different species like strepmitis and oralis and bovis that have been grouped together just because they all kind of do the same thing, which is, to be honest, not that much. These are commensal organisms, so they are part of our normal flora, but they can cause trouble when they get where they're not supposed to. These ones are often alpha hemolytic. That's where the name viridins comes from, because viridins is like green and alpha hemolysis causes that greening. But some of them are gamma hemolytic as well. So it's really, just kind of a historical thing that we call them viridin strep. Usually they live in the digestive system. So it's common to find them as contaminants for specimens that have been in the mouth, in the esophagus, in the intestinal tract. You do also find them sometimes on the skin and also in the genital tract. But when they get where they're not supposed to, such as causing endocarditis, sorry, I don't know why this picture is not loading quite right, but it's the same picture of endocarditis as before, where it gets in the blood and it attaches to your heart valve and it can cause life-threatening disease. This is especially in more vulnerable people like those that have prosthetic heart valves. So again, viridin strep is not that nasty. Often it can be a contaminant, but it can also be real and it can cause life-threatening infections if it gets into a sterile site. Finally, we have strep panginosus. So this is another one of those in-between sort of species where it can be part of the normal flora, but it can also cause nasty infections. So it's similar, again, to organisms like Staphylococcus, where you really do have to put your thinking cap on and think, what is the relevance to my patient if this is growing in a culture? It can be any of the hemolysis patterns, so that's not particularly useful, so don't worry about memorizing that. It's often found in the digestive system. So again, it can sometimes be contaminants of specimens contaminated from the digestive secretions, but it can also cause really nasty infections, especially if it gets outside of the digestive tract. For example, it causes intra-abdominal abscesses that can require surgeries even to drain them. So again, strep panginosus kind of is on the spectrum between the viridin strep and things like strep pneumo, where it's sometimes, normal part of the healthy body flora, but it can also cause very severe infections. So that's everything I had to say for streptococcus. And the last group to talk about is enterococcus. So enterococcus are also gram-positive cocci in pairs and chains. There's only two main species that you guys have to be aware of. It's Enterococcus faecalis and Enterococcus faecium. I'm oversimplifying a bit here, but I think the easiest thing for you guys is to think of these as also kind of nasty. They are part of the normal flora, especially in the digestive system. All of us have enterococcus in our bodies, but they also do have this virulence where they're relatively common causes of serious infections, especially in the hospital setting. So they do cause urinary tract infections, which can include kidney infections, which can be life-threatening. If they contaminate a PICC line, for example, then they can cause blood infections from that. And they can also get into the bloodstream and infect heart valves, both native heart valves and prosthetic heart valves, and cause life-threatening endocarditis. So, these are not the most common organisms, but enterococcus can be real. And again, you really have to put your thinking cap on if you have a patient with one of these in a specimen and think, could this be the explanation for why my patient is sick? So that's really all the organisms that we have to talk about today. I'm going to make just a quick note about antibiotics. This talk isn't about antibiotics. That's separate learning that you'll have to have. But I'll note that some gram-positive cocci have special names because of antibiotic resistance. So MSSA is short for methicillin susceptible Staph aureus, which is essentially a historical acronym that says beta-lactams can work. So, MSSA is something that you could use cloxacillin, you could use cefazolin for. MRSA, which some people also pronounce MRSA, is methicillin-resistant Staph aureus, which basically means beta-lactams do not work. So you can see how that could be a big problem. So MSSA and MRSA are definitely names that you have to memorize. Enterococcus faecalis and Enterococcus faecium also have some antibiotic differences. Faecalis is penicillin susceptible, so beta-lactams can work on it, while faecium is penicillin resistant, and beta-lactams actually don't work on it. I have trouble coming up with a good mnemonic for this. Some people would say, oh, faecalis ends with an S, so it's susceptible, and faecium ends with an M, so it's not susceptible. Or the M in faecium is because it's similar to MRSA in terms of its resistance. Whatever works for you. I think it is something that could be testable, that faecalis is often susceptible to penicillins and faecium generally is not. Finally, VRE is vancomycin-resistant enterococcus. This is important because VRE, you can't use vanco, in addition to not using, for example, beta-lactams for Enterococcus faecium. So it's actually quite a big problem. So again, this is not a talk about antibiotics, but I do think MSSA, MRSA, and VRE are some names of bacteria that you do need to know. So that's the end of these lectures on gram-positive cocci. Again, for all of our typical bacteria that would grow in regular cultures, we can see that the three main genera of gram-positive cocci are Staphylococcus, Streptococcus, and Enterococcus. And inside of each of those, they have species that are more nasty and are likely to be the cause of infection, like Staph aureus and beta hemolytic strep, as well as species that are not so nasty and more prone to be part of the normal flora or contaminants, like coagulase negative staph and virulence strep, but can also cause serious infection in some patients. So I hope this was educational. I hope that this basic information is something you can take with you as you see more patients and as you learn more about clinical infections and the use of antibiotics. My final slide is just some references for all of the open source pictures that I included during this talk, and look forward to seeing you in our next lecture.